Daily case numbers in Cambodia struck a record high of 1,130 on Wednesday, far more than reported in April when severe lockdowns, bans on alcohol sales and travel between provinces were imposed. Cambodia, though, like most developing countries, faces a range of problems not typically associated with wealthier countries in the West, particularly overcrowding in the capital, Phnom Penh, where several people often rent one room, in some cases one bed, to find a few hours sleep away from the grind outside. Bradley Merg, a senior advisor to the Cambodian Institute for Cooperation and Peace, says people here simply don't have the space, security or access to health services and supermarkets of those in the leafy suburbs of countries like the United States.
There are naturally going to be challenges in light of the level of development, in light of the daily needs of the population, etc. Ultimately, a permanent lockdown or long-term lockdown is simply not a feasible strategy in Cambodia or in Phnom Penh specifically.
The closure of markets resulted in food shortages and price gouging, with authorities struggling to enforce lockdowns after dividing the capital into yellow, orange and red zones, depending on case numbers and transmission risks. Restrictions have eased, but schools, bars, gyms and many other businesses remain closed, while restaurant hours have been curtailed with strict social distancing and other health measures in place. Hang Sokantia, an academic and author of I Am a Daughter, a book about female empowerment in Cambodia, says life during the pandemic has been harsh for the poor.
A lot of the poor families live very close to each other, and which is where a lot of the red zone was located when they live together, and then they spread the COVID infected even faster, and without market, without having the living income, they just cannot really make much of the living.
Cambodia had emerged relatively unscathed from the pandemic during its first year, but that changed on February 20 when authorities say 2 Chinese women bribed their way out of quarantine, went out dancing and spread the disease. Since then, the number of confirmed cases has climbed from less than 500 to more than 50,000, with more than 44,000 recoveries and 602 deaths. However, Cambodia is ranked second after Singapore in its vaccination rollout among the 10 Association of Southeast Asian Nations countries, after securing about 11 million doses of Sinopharm and Sinovac from China. Officials say a total of 20 million doses will be secured by August, while funding from Australia and the United States has enabled access to the COVAX facility and AstraZeneca vaccinations.
And when one places Singapore in comparison to Cambodia, in terms of level of development, level of infrastructure, etc., it's truly remarkable that Cambodia has had this level of success in its all-of-government campaign to roll out vaccination as quickly as possible. The kingdom is well on track towards meeting its goals, and it's a story that has not received nearly the attention that it deserves.
About 18% of Cambodia's 16.5 million population have been fully vaccinated, while a quarter have received a single dose. Cambodia hopes to reach herd immunity with 10 million people vaccinated by the end of the year, and it wants to reopen its tourism industry in the 4th quarter to fully vaccinated tourists. Luke Hunt for VOA News, Phnom Penh, Cambodia.
استهداف